here to show you a few tips on how to get stronger for your hip surgery. So these are exercises and positions you can do before your surgery in order to get as strong as possible and have the best outcome as possible before hip surgery. There are several different types of hip surgeries which we'll go over in class. There's a superior approach, an anterior approach, and a posterior approach to your hip surgery. And each approach has different precautions associated with it. So please find out which hip surgery approach you'll be getting, and I'll mention that throughout our exercises. So just for ease of a visual, this is going to be my painful hip, or my hip that's going to have surgery. So you guys know which one we're looking at here. The first exercise is squeezing or contracting the quadriceps muscle, the muscle along the top of the thigh here. So sitting up in the bed, you can sit up against the headboard of the bed. You can be in a recliner chair. You could be on the floor if you can get down to the floor. That's fine, but I just wanted to show you what different positions you can do, okay? So contracting the quadriceps muscle, you want to prop your leg up on something, either a towel roll, a pillow, or something more firm like a foam roller I have here. And what you want to do is squeeze that quad muscle and push the knee down in order to get more and more contraction on the quad. The quad is the muscle that helps you walk, and it does connect to the hip area. So the stronger that quadriceps muscle is, the more protected that joint will be after surgery. So you squeeze and release. Squeeze and release. Try to do that up to 30 times if possible. The next exercise is specific to your buttocks muscles, and it's easiest to do this on both legs at the same time. So the surgery leg or the painful leg and the better leg. So what you'll do is you'll squeeze your glutes together, hold for 5 seconds, and release. Try to do this activation 30 times if possible. If it's too painful with your knees straight, you can bend the knees and do the same contraction in your glutes. The next exercise would be easiest with a big piece of cardboard or a flattened out box so your feet can slide in and out easily. Sitting in this position, or flat if you would rather be flat, that's fine too, or in a recliner chair. Try and keep the toes up, and you're going to simply open the hips and then bring the feet together. Okay. You're targeting the muscles on the outside of the hips and then the inner thighs. Really important muscles for hip stability. Try and do 30 reps in one sitting. This is a basic range of motion exercise to get as much motion as possible in your current hip joint. The more motion you have in the joint before surgery, the better outcome you're going to have after surgery. So you're bending the hip up as high as possible, and then fully straightening. Make sure you keep your foot or your heel in contact with the surface that you're pushing from, so you're not overstraining that hip flexor muscle. Try and do 30 reps in one sitting. Again, for this one, you can use a rolled up beach towel or just a rolled up towel to put underneath your knee. You're going to strengthen the quadriceps muscle again, except this one's a little harder. You're actually going to lift your leg using that muscle. So keep the knee bent in the starting position and then lift the leg into a straight position. Hold for 5 seconds and slowly lower the foot. Try to work up to 30 repetitions in one sitting. Okay. This one would be sitting in a regular back chair. Try to scoot yourself close to the back of the chair for support on your back. Use the armrests if you need to. And you're simply lifting the lower leg all the way out into the straight knee position. Holding for 5 seconds, again contracting the quadriceps muscle, and lowering the leg. This is a harder exercise than the last 2 quadriceps exercises. Try to work up to 30 repetitions in one sitting. This exercise is in standing. If you use a walker, you can go ahead and just use the walker for the exercise. If not, use the back of a chair. You're simply going to go up onto your toes, hold for 1 or 2 seconds, and come back down flat-footed. This will get your calf muscles strong enough to walk further distances after surgery. Try to work up to 30 repetitions in one set. In this exercise, you're really targeting the quadriceps muscle again, but you're stretching it this time. So you're going to do a heel curl. You're going to take the heel and lift it up. And again, that's stretching the quadriceps muscle. Hold for 5 seconds and lower the foot. And again, try to work up to 30 repetitions in one set. In this exercise, you want to get more and more weight through your surgical leg to keep it stronger for surgery. So what you'll do is rock forward on the non-painful leg and then push back on the painful leg, accepting as much weight as possible through that back leg. So it's a forward rock and then a backwards rock. Try and work up to 30 rocks in one set. So this exercise is targeting your hip muscles in the standing position. It's basically going to help you get in and out of a chair before surgery and after surgery. Really important exercise. Holding onto the back of a chair, do just a partial squat. So you're not sitting all the way down into the height of a chair. You're just coming partially down and back up, squeezing your glute muscles on the way up. Try to work up to 30 repetitions in one set.